friends, it's Dr. Cameron Rokhsar. So you guys asked me to comment on a very popular topic, and that's volume loss of the face. It's a very interesting subject. It's a subject we've learned a lot about the past 10 years, and I want to take you through some of what the etiology is of volume loss in the face, and also how we can really treat it in the modern age of fillers and so on and so forth. So the first thing I want to bring your attention to is when we look at a youthful face, the most remarkable thing that you notice about this face is the fact that the contours are all blended in. There is no clear marks of demarcation. And that's really the highlight of a beautiful youthful face. There is really no folds. There's nothing that delineates the different anatomic areas, whether it's the eyelid, the cheek, everything just flows smoothly into each other. And so when you get a little older, things happen to change, and you're going to see lines of demarcation in different anatomic areas. And we have a lot of different names for these lines of demarcation. For example, this line, we call this the tear trough or nasojugal groove. We call this laugh lines. We call these marionette lines. These are just lines of demarcation that happens with aging. So what's really happening with aging? The number one thing that's happening with aging is volume loss. Now, what's losing volume? So the number one thing that loses volume is fat. We have fat pads here in our cheeks. We have fat pads everywhere, actually. And as you get older, you lose volume in these, in these fat compartments. The number two thing happens is that the fat pads in the cheeks actually descend downward. So they actually descend downward, and the fat pad compartments in the lower eyelids protrude out. And so some people call that, have eye bags, or have, my eyes look tired, but that's really what's happening. And so as this happens, a line of demarcation forms here. Another thing happens is that you actually get loss of volume of your facial muscles as well. It's not just the fat. So the underlying muscles also become weaker, and as they become weaker, they atrophy. The number three thing happens with an aging face is actually your bony anatomy. So the actual bone, your skull, loses volume. It undergoes osteoporosis. Osteoporosis is not a phenomenon that's just unique to the spine or to various bones in your body, but your actual skull shrinks as you age. So that contributes to your volume loss as well. Obviously, we really can't do much about skull bone loss. I mean, you could certainly do your osteoporosis treatments and so on and so forth. But the way to address all these issues is we can actually put fillers. We can put fillers in these different compartments, right? And generally, the nice way of doing fillers in these areas of volume loss is you want to put it underneath the muscle. And that's a very common issue that I see. People inject fillers too superficially, whether it's in the cheeks, whether it's in the eyelids, and then you get the Tyndall effect. You get a problem with the filler showing, and it doesn't look good. It looks lumpy. It looks bluish in color. That can be avoided by the right placement of filler in the right anatomic plane, which is a deeper plane. So we can easily fill in the mid-cheek compartment. We can fill in the lateral cheek compartment, and that can give you a vector lift that can actually pull the face this way into a vector, into a triangular face. We can then slightly fill in these lines. We can fill in the marionette lines. And you may ask what filler I like for different anatomic areas, and it really depends on the person. It depends how much volume you've lost. It depends how far along you are in the process of volume loss. The heaviest filler we probably have is Voluma. I like Voluma a lot for cheeks. I also like the Restylane Lift a lot for cheeks, a heavier version of Restylane. I like Radius for cheeks, and you can really contour these areas. Here we can use softer fillers. Restylane, Juvederm. If you have really heavier folds, we can use volume on that area. Usually, so I like to keep fillers for this lower half of the face. The upper half of the face, for volume loss, I always like to inject Botox because it's the muscles that's causing these folds to form. We want to inject a toxin to relax these muscles here, And then if these don't get better, you can go back and you can fill in with fillers as well. Lastly, as we really age, then the process becomes progressively worse. Not only are you getting volume loss, and volume loss, we call that sinking, but you also are getting looseness of your skin, and that's called sagging. So there's two issues that happens here. You got volume loss, plus you got looseness of the skin, and your skin, it doesn't maintain its recoil capacity, and that's why things kind of hang. And here is when lifts come in, whether you have a surgical lift you could do, or whether there are non-surgical tightening procedures like Ulthera, or actually for this stage of the game, I really like Thermitite. Thermitite is the golden standard. You can get mini facelift-like results with Thermitite without actually undergoing the knife. So I hope this gives you guys a good summary of really what volume loss is all about and the different ways that we can address it. Signing off, Dr. Cameron Rokhsar.